Hello everyone. In this video, we're going to be taking a look at an article from The Federalist. This was published on March 25th and written by Madeline Osborne. Before we get into it though, this is going to be my inaugural post over on library.tv. Now, if you're looking for an alternative or a place to find my content where YouTube suppresses it, other than BitChute, feel free to subscribe to me here. If you want, subscribe to me over at BitChute. I'm also at DTube. But yeah, feel free to subscribe. But like I said, this is my inaugural video there. So let's get into things. Oh, look at the title here. Inaccurate virus models are panicking officials into ill-advised lockdowns. How a handful of Democrat activists created alarming but bogus data sets to scare local and state officials into making rash economy-killing mandates, which was the intent. They figure if they implode the economy, it's their way to get Trump out of the Oval Office. They tried and failed with impeachment. Now they're thinking, hey, if we blow up the economy and destroy America, Americans will get fed up with him and they'll vote him out of office and put senile old Joe in. Seriously, this is their idea, or their last minute replacement if they decide Joe isn't the one. But I can tell you right now, they're going to do everything to make sure Bernie ain't, or isn't, for those people who, care for proper English. But anyway, let's get into this. As U.S. state and local officials halt the economy and quarantine their communities over the Wuhan virus crisis, one would hope our leaders were making such major decisions based on well-sourced data and statistical analysis. That is not the case. Well, of course it isn't, because you know what? The Democrat mantra, never let a good crisis go to waste. So, of course, when you have Democrat activists and the legacy media and others pushing this idea of we got to shut everything down, which would literally destroy this economy, it would destroy the wealth of this nation, it would destroy the wealth of the American people, especially the middle class, because they have their retirements tied up in things like 401ks that, are based off of stocks and things of that nature, bonds, other, investments. So they basically want to destroy the country, thinking it's going to get Trump out of office. Anyway, a scan of statements made by media, state governors, local leaders, county judges, and more show many relying on the same source, an online mapping tool called COVID Act Now, which is this website right here. Now, they have maps for all these locations, and they're like ridiculous with each state. Their figures are way off with what we have and what they're predicting. I did a little comparison myself where I live here in New Hampshire, and it's not nearly as bad as they're claiming it would be at this point. But yeah, this is what these people are, these people in politics, these governors and these mayors and that, and other state officials are basing their thing on, their stance. The website says it is built to enable political leaders to quickly make decisions to their coronavirus response informed by best available data and modeling. Now, this is what's funny is best available data would mean that they have accurate data, that the modeling would be accurate, but that's not their intent. They want to scare people. An interactive map provides users a catastrophic forecast for each state should they wait to implement COVID Act Now suggested strict measures to flatten the curve, which they want 3 months. 3 months of shutting down this country, which is what CNN parroted, which is what Obama, era officials that are out there are parroting. They figure 3 months, they can destroy the economy and they can somehow turn that on to Trump. Or use it in some way to get him out of office before the election. But yeah, that's why they're doing this. But a closer look at how many of COVID Act Now's predictions have already fallen short and how they've become ubiquitous resources across the country, and how they became a ubiquitous resource across the country overnight suggests something more sinister. When Dallas County Judge Clay Jenkins announced a shelter-in-place order on Dallas County Sunday, he displayed COVID Act Now graphs which predictive outcomes after 3 months if certain drastic measures are taken. The NBC Dallas affiliate also embedded the COVID Act Now models in their story on the mandate. I mean, here you are. mean, he's using this. The headline of an NBC Oregon affiliate featured COVID Act Now data and a headline blaring, coronavirus model sees Oregon hospitals overwhelmed by mid-April, which the funny thing is they're actually saying that they're overwhelmed now using this data. They're leaving out the fact that this is a prediction of mid-April. If you look at all these, legacy media outlets that are saying, oh, yeah, they're screwed already, when they're not. This is the April prediction that they're using, all right? And on the same idea of touting that bullshit, the Young Turks, Cenk the water buffalo, he's doing the same thing with Anna. They're trying to push this fear-mongering. It's almost like, when Democratic kingmakers give you money or you're run by people who are buddy-buddy with those said Democrat kingmakers, you push a lot of bullshit. I mean, don't get me wrong. This is serious, the WuFlu. But I also understand that this is a perfect opportunity for them to try to pull some bullshit. And it's clear that's what they were trying to do with this, or they are trying to do. Both the Oregonian and the East Oregonian also published stories featuring the widely shared data predicting a point of no return. Which, you got right here. You've got it right there. Michigan Governor Gretchen Whitmer cited COVID Act Now when telling her state they would exceed 7 million cases in Michigan, with 1 million hospitalized and 460,000 deaths if the state did nothing. Now, what's funny is there's also an article out there about her. It's a CNN article. I can't remember the title, but she's bitching that after the governor said, look, we're cutting each other's throats. We're trying to get this done. It would be better if the federal government handles this and then divvies up the stuff. That's what happens. She gets upset that, our order got delayed. Well, you all said you wanted the federal government to handle shit and then hand it out to you. You can't have your cake and eat it too. She's a real piece of work. But yeah, I mean, she's trying to put fear into these people. I mean, don't get me wrong. This is very serious. But she's trying to put a fear that's far worse than what it is. I mean, trust me. I agree with a lot of Mr. Medicare's assessments, but also on the same note, because he's been covering this, but also on the same note, I understand that shutting down the economy and everything and not taking other measures, we're fucked. We're fucked if we do, we fucked if we don't. Just to put it bluntly. A local CBS, but see, the thing is we're not as fucked as we think we are. That's the thing. Before we go any further, because we have inaccurate information. We need accurate information. Now, if their information was accurate and their assessment wasn't based on political objectives, I might go along with it and say, maybe we should be looking at the fact of, keeping things away for a month or whatever. I wouldn't do 3 months, because 3 months you could still have this going on. And then you're going to say 6 months. And then you're going to say a year. And then you're going to say 18 months, a year and a half, which is what some of these people are calling for. They really want to kill the economy. They basically want to destroy the middle class. They want to destroy the ability of the American people, to survive, because they want them dependent on the government. Because they're like, well, if we destroy the economy, people will want to go to socialism. That's kind of what the mentality is with this. Which means they become more dependent. They'll be more likely to vote Democrat in their minds. It's ridiculous. Anyway, a local CBS report in Georgia featured an Emory University professor urging Governor Brian Kemp with the same point of no return language in COVID Act Now models. And then you got his, I'm assuming this is the guy's tweet here. We need Governor Kemp to act now. The point of no return for Georgia is rapidly closing. To prevent a catastrophe in healthcare system due to WuFlu, we need him to shut down Georgia now. They're all calling for this. They want everything shut down. It isn't about health for them. This is about political means. It's so sad and disgusting. You would think these people would be more concerned with the people, the actual numbers that could die. They want to fearmonger and panic and lock things down for months to try to fuck the economy. This is what this is about for them. This isn't about actually saving people's lives. The models are being shared across social media, news reports, and finding their way into officials' daily decisions, which is concerning because COVID Act Now's predictions have already been proven to be wildly wrong. COVID Act Now predicted that by March 19th, the state of Tennessee would expect 190 hospitalizations of patients when confirmed with confirmed WuFlu. By March 19th, they only had 15, which goes to show they're pumping up the numbers. In New York, COVID Act Now claimed nearly 5,400 New Yorkers would have been hospitalized by March 19th. The actual number of hospitalizations is around 750. The site also claimed nearly 13,000 New York hospitalizations by March 23rd. The actual number was around 2,500. Yeah, so we're way behind the curve, okay, that they're predicting here, but yet they want to still push this shit. It's so funny that they're actually willing to play with people's lives for a political fucking agenda. This is not the time for it. In Georgia, COVID Act Now predicted 688 hospitalizations by March 23rd. By that date, they had around 800 confirmed cases in the whole state and fewer than 300 hospitalized. Well, that goes to show, thinking about it, they're about 50%. Well, I was trying to do the math in my head. I'm sorry. It's less than 50%. They're at less than half of what's being claimed. Probably like 48%, maybe 47%, somewhere around there. Which goes to show how much they're padding the numbers. In Florida, COVID Act Now predicted that by March 19th, the state would face 400 hospitalizations. On March 19th, Governor Ron DeSantis said 90 people in Florida had been hospitalized. They're at less than 25% of what Florida claimed. I mean, this goes to show. I hate the fact that this is being politicized like this. I mean, you want accurate information. They're talking about Trump lying and talking out their ass when you've literally got these assholes on CNN and MSNBC and even on local stations pushing this shit using this flawed data, this flawed information. COVID Act Now's models are in other states, including Oklahoma and Virginia, were also far off in the predictions. Jordan Shachantel, a national security writer, said COVID Act Now's modeling comes from one team based at Imperial College London that is not only highly scrutinized, but also has a track record of bad predictions. So let's see what his tweet here said. Their models come 100% from Imperial College UK projection that is coming under heavy scrutiny from scientific community. ICUK produced the famed doomsday scenario that guaranteed 2 mm dead Americans. 2 million? The man behind the projection is refusing to make his code public. Jessica Hanslew at New Scientist notes, the systematic errors researchers and scientists have found with the modeling of COVID Act Now relies on. Chen Shen at the New England Complex Systems Institute, a research group in Cambridge, Massachusetts, and his colleagues argue that the Imperial team's model is flawed and contains incorrect assumptions. They point out that the Imperial team's models doesn't account for the availability of tests or the possibility of superspreader events at gatherings and has other issues. Among other issues, COVID Act Now lists the known limitations of their model. Here are a few of that seem especially alarming, considering they generate a model for each individual state. Yeah, this is completely flawed. They know it. They say it. But yet we're supposed to accept it as gospel. That's how the left and the Democrats work. We tell you something, you better believe it. Even if it's complete bullshit. Many of the inputs into this model, hospitalization rate, why does it say hospitalization rate twice in quotes? Are based on early estimates that are likely to be wrong. Yeah. So they're admitting right off the bat, our estimates are wrong. But you need to trust us. Demographics, populations, and hospital bed counts are outdated. Demographics for the USA as a whole are used rather than specific to each state. So, yeah, New Hampshire's going to be different than, say, even Massachusetts, which borders it. It's going to definitely be different than California, and Vermont's going to be different than a lot of other states, and Oklahoma's going to be different than another, and Utah, and hell, Montana is kind of sparse, so they're going to be definitely different. I mean, so, yeah. The model does not adjust for population density, culturally determined interaction frequency and closeness, humidity, temperature, etc., and calculating RO. So basically, they're not looking at the fact of, well, someone in Wyoming is going to have less exposure to people in general than, say, someone in New York City or New York State or Boston or Massachusetts or Miami. Come on now. But yet we're supposed to take this as gospel. This is not a node-based analysis and thus assumes everyone spreads the disease at the same rate. But that's not how reality works. Diseases spread with different people at different rates. In practice, there are some folks who are super spreaders and others who are almost isolated. Yes, you're going to have typhoid Marys, and then you're going to have people that are asymptomatic that don't have contact with people really. So why is the organization or seemingly innocent online mapping tool using inaccurate algorithms to scaremonger leaders into tanking the economy? Politics, of course. Yeah, exactly. Founders of the site include Democratic Rep. Jonathan Christ Tompkins and 3 Silicon Valley tech workers and Democrat activists, Zachary Rosen, Max Henderson, and Igor Kaufman, or Igor, who are all also donors to various Democratic campaigns and political organizations since 2016. Go figure. Now, mind you, these would all be people that, if the economy implodes, they've made their nut off of Silicon Valley or other means, and they're not going to be hurting financially. They're going to get to live in their mansions. They're going to get to drive their expensive cars. They're going to get to eat their expensive food. They're golden. They don't give a shit about you or me or anyone else. All they care about is getting a Democrat in office because big bad orange man. Oh, you gotta love this. Henderson and Kaufman donated to the Hillary Clinton campaign in 2016, while Rosen donated to the Democrat National Committee. Recently resigned Democratic Rep. Katie Hill and other Democratic candidates prior to building the COVID Act Now website. Kaufman created an online game designed to raise $1 million for the eventual 2020 Democratic candidate and defeat President Trump. The game's website is now defunct. Probably a good thing. This is so sad. These people are disgusting. Perhaps the goal of COVID Act Now was never to provide accurate information, but to scare citizens and government officials into implementing rash and draconian measures. Yeah, they also want that. Because if you think about it, they're figuring, well, they'll get shit locked down. They get a Democrat in. Do you think they're going to, let up on that shit? Of course not. No, you've got Democrat people talking about coof camps and shit. Where do you think the first people are going to be going to the coof camps, even if they don't get the coof? If they were to, say, take power during this lockdown or bullshit like that, if they were able to extend it past the election, it'd be people that voted for Trump and shit like that, probably. And I say that half joking, but they'd think about it. They would. The creators even admit as much, with the caveat that this model is designed to drive fast action, not predict the future. Yeah. They want the rash draconian measures, and they figure the easiest way to do it is to scare the shit out of people. They generated this model under the guise of protecting communities from overrun hospitals, a trend that is not on track to happen as they predicted. Not only is the data false and looking more incorrect with each passing day, but the website is optimized for a disinformation campaign. I looked through it real quick. It's kind of 1984-ish, to say the least. A social media share button prompts users to share their models and alarming graphs on Facebook and Twitter with the autofill text. This is the point of no return for intervention to prevent excess hospital system from being overloaded by coronavirus. Sounds kind of like the whole Paris Accord, Green New Deal, we're at a point of no return, blah, 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 bullshit. The daunting phrase, the point of no return, is the same talking point being repeated by government officials justifying their shelter-in-place orders and filling local news headlines. Yeah. I mean, don't get me wrong. We should be social distancing, and we should be doing all the things to prevent the spread of this right now, to minimize it. But things are being blown out of proportion to an extent. I mean, it's really serious, but they're trying to make it sound like fire and brimstone, cats and dogs living together, all that type of fun shit. When it's not quite that bad. It's bad, but it's not, fire and brimstone and cats and dogs actually getting along. Democrats are not going to waste such a rich political opportunity as a global pandemic. Of course they're not. Americans already witnessed Speaker of the House Nancy Pelosi and House Democrats attempt to take advantage of an economic recession with a pipe dream relief bill this week. Yeah, they wanted to do diversity and all this other shit. They were holding the American people hostage to basically get identity politics leftist bullshit and get it to where employees get to start dictating shit in a friggin' company that they don't own. They want to dictate in a company? Buy fucking stock. It's really that simple. But no, they should get seats on the board. That's not how it works. But that's what Nancy wanted. So she figured she'd hold the country hostage. Senile old bitch. Seriously. Actually thinking she'd get away with that shit. Projects like COVID Act Now are... COVID Act Now are another attempt to play the same political games, but with the help from unknown, behind-the-scenes Democratic activists instead. Yeah, and they're using these graphs to scare people. That should make you think that, well, okay, it is serious, but shit, maybe we should take a step back. Because locking down this country and freezing the economy like they want is literally going to wipe out the majority of Americans financially. You are going to have a situation that would make the Great Depression, would make the results of the 1929 stock market crash pale in comparison, even with the fact that FDR and his policies actually extended the Great Depression, because we were already starting to see a recovery. And, I'm going to do this. Instead of having private companies do these works projects, which would hire Americans and pay them a higher wage and actually be using, like bulldozers and steam shovels and shit to build roads instead of men using pickaxes and shovels. All right. FDR was like, look at all these people I put to work. They were all doing menial labor with pickaxes and shovels and shit. My grandfather was a member of the Civilian Conservation Corps and literally helped build a bunch of shit in the New England. And the thing is they used hand tools. So, yeah, that's what they'll probably do with this shit. Well, we'll put Americans back to work after they fuck the economy. If they manage to get in power, they'll try to do some New Deal bullshit, which will have like Nancy Pelosi, AOC fucking bullshit, like Green New Deal and identity politics tacked onto it. And they'll have us doing menial fucking bullshit as we're piss poor broke, and we should be worshiping them for the handout we're getting because they destroyed the economy. That's probably what they want to do here, just to get rid of Trump. It's disgusting. These people are vile. This is what they want. Our community leaders, the mayors, and the city councils deserve better than to be swindled by a handful of Silicon Valley tech bros. Our governors and state officials deserve better data and analysis than a Democrat activist's model that doesn't adjust for important geographical factors like population density or temperature. Americans and their families deserve better than to be jobless, hopeless, and quarantined because of a single website's inaccurate and hyperbolic hospitalization models. That's an understatement. That is an understatement, all right? We should not be subjected to some psyops bullshit that's trying to exploit a pandemic. For these little weasels in Silicon Valley and the others involved to think that this is something good to do, if this came out to the mass population of the United States, do you think these people would be liked too much? No. They'd probably be fearing for their lives on getting a lynching. If things go to shit because of these idiots and the disease isn't as bad as what it is and people know it's them, people are going to want them strung up and hung or drawn and quartered, if they can find 4 horses. I mean, seriously, because this could royally fuck this nation over, destroy our economy, what they're trying to do. And they're just laughing about it because they already made their nut in Silicon Valley or in other areas. It's disgusting. These people are vile. Anyway, yeah, I've covered this well enough. If you want to go check out their predictions, it's all one word, covidactnow.org. But yeah, if you want to go check it out, go see how crazy they are with their predictions and shit. It's like, yeah, fear-mongering central. But yeah, anyway, I've covered this well enough. Again, first post over on library.tv. Feel free to subscribe to me over there. But anyway, I'm done. I'm out of here. If you liked this video, depending on where you are watching it, please give it an upvote or thumbs up. If you want to know when new content of mine hits the internet, don't forget to subscribe to one or more of my social media or video accounts listed here. Also, with YouTube, don't forget to ring that bell. You can find all of my video content on both BitChute and YouTube. This may not be the case with other places I upload to, but I will try to minimize this happening. You are always welcome to interact with me at any of these sites on the list, so feel free to do so. If you have anything you want me to cover in a video when it comes to news or current events, send it right along to me. I will try to do my best to cover it. As always, thank you for watching.